Hello, welcome to Chapter 13, Part 2, where we continue with the exciting world of blood. Now, to get to something a little confusing, blood types. This is confusing because there are A and B antigens on the cells, and A and B are co-dominant, which means they are equally dominant, and then there are A and B antibodies in the blood plasma. Now, the antibodies will attack the antigens. If the wrong antigen is given to the if the wrong antigen is given to the donor's antibodies will attack the person's antigens. And as a result, will end up in clumping and the person will die. This is pretty confusing, but the best way to do it is to remember that who can do it. The safest transfusion is to get the same blood type. O is the universal donor. It can be given to anyone, A, B, or O. And AB is the universal receiver. The reason why O is the universal donor is because there are no antigens on the blood cells. So the blood cells will not react to anything in the in the receiver's blood. Donor O has no antigens, so therefore it will not cause agglutination with the antibodies in the receiver. AB is the universal receiver. That's because they have no antibodies. So since they have no antibodies, they cannot attack the antigens on the blood. Okay, so A has A antigen, B antibody. B has B antigen, A antibody. AB has AB antigens and no antibodies. O has no antigens and AB antibodies. Now, O is the universal donor because you're getting no antibodies. However, O can only take O blood because they have anti-A antibodies, so they'll destroy A antigens on anyone's blood, and they have anti-B, so they'll destroy they'll destroy B antigens on anyone's blood. So it must be O. Now the same thing is compatible with the RH factor. The RH factor, RH negative, means you do not have an antigen. And RH positive means you have an antigen. So the true universal donor is RH negative and O blood type. Okay? When you look at it, what happens is when you actually get a blood typing sample, and I suggest you learn your blood type, not only because it's cool, but then this helps make a little more sense. What they do is they put the anti-blood type. So if you are O type, it will agglutinate, which means your cells clump. And you just go through the tests. I am an O positive blood type, which means I have no agglutination with the anti-A's, no agglutination with anti-B, but my positives agglutinated. Okay? When it comes to blood compatibility, O can be given to anyone and the other ones can't. Now, RH factor is the same thing. RH stands for rhesus monkeys, which was developed. And RH positive blood has the antigen. RH negative lacks the antigen. And in normal situations, because you haven't received any sort of blood, RH negative blood does not have an antibody to fight the antigen unless there is a problem with a hemolytic disease. And this will occur in a newborn of the second child, not the first child. And it's very specific. The mother must be RH negative. The father must be RH positive, which results in the child being RH positive. During the first pregnancy, no problem, because the blood supplies do not actually mix. So the antibodies cannot cross, or the these cells cannot get into the mother to make antibodies. Normal baby, no problem. However, during the birthing process, there is a mixing of the blood. The baby's blood cells with the Rh positive antigen will get into the mother. The mother will then make antibodies, which are these little Y-shaped things, to react with the Rh positive antigen. Not a problem in the first baby because the blood does not mix until birth of the first baby. Now, often during the second pregnancy, there can be problems and you're not even sure you have problems because you can have a miscarriage. If you don't have a miscarriage, you can have a hemolytic disease of the newborn, which means if the second child is Rh positive and the mother still Rh negative and developed these Rh positive antibodies during the first blood exchange, her antibodies will attack the blood cells in the baby, resulting in big problems in the baby. You can't get a blood transfusion. Usually what they do is if this situation happened, during birth, they give the mother a shot to prevent these antibodies from forming. Without the antibodies, you can't attack. Okay, only a problem if Rh positive baby, Rh negative mother, second birth. Okay? Blood components. Blood transfusions, very common. I suggest you try taking one. I had a lot of blood transfusions in university, not blood transfusions. I donated a lot of blood in university because they fed us donuts. And I was a true university student. We actually got excited, and this was before the big AIDS scare in the late 80s, so we got quite excited when the donut people arrived on campus. They do set up blood transfusions here in Edinburgh College. Oh, but you're not on campus. If you can get your blood typed, get it typed. And if you can donate, even better. They're very picky about blood transfusions and blood donating now, but that's just for the safety of the bank. Please realize that the blood can be stored up to 35 days. Some people who are going in for surgery may actually bank their own blood. An anti-clotting solution is added, and actually they take the calcium out. Why do they take the calcium out, you ask? Is because the calcium is a cofactor in that clotting process of the prothrombin being produced into thrombin. Needs calcium. No calcium, no reaction, no agglutination. Blood donated surgery, there's an expiry date. They only take 454 milliliters, which is just slightly larger than a can of pop. Out of you have 5 liters of blood. You can usually produce it quite quickly within a day and a half or two if you are normal. Blood is centrifuged, and that is, do I have a centrifuge? No, I don't have a centrifuge picture here. And they separate it. Sometimes they will just use the plasma. Sometimes they use the cells. I'm not going to go into a lot of detail here. Quick look at abnormalities in blood. Anemia is low iron, low red blood cells, difficulty transporting oxygen. You're tired. Leukemia is a decrease in white blood cells. It actually has to do with blood cancer. Decrease in white blood cells mean you have an impaired immune system. Clotting disorders. Hemophilia is one. Hemophilia has to do with missing a clotting disorder in the cascade of blood clotting. Okay, there's all sorts of different types of anemia. Basically, you can't produce the cells or they get destroyed too quickly. I'm not going to get into the details. Or it has to do with basically the bone marrow or the amount of iron. One thing I want to point out is sickle cell anemia. Sickle cell anemia is a genetic disease. The hemoglobin does not form correctly due to one base pair change, and you end up with these sickle cells, and these sickle cells will then get plug the capillaries. Okay, leukemia. Leukemia is a blood cancer. It's characteristic by a large amount of white blood cells. You can have, they completely irradiate your bone marrow, which is used in producing the blood cells, and then they give you new people's bone marrow. Sounds simple. It's pretty simple now, but it still is quite concerning. Clotting disorder, hemophilia is a common one. Hemophilia is it's genetic on the X chromosome. It was the royal disease. You may have studied it and we looked at genetics. Okay, then there are tests with blood. The first test with blood is a hematocrit. A hematocrit tests the percentage of the blood cells. It doesn't tell you right away what's going on, but it gives you an indication that something is going on in a certain area. For example, here's normal. If you have a low amount of red blood cells, that means something's happening to your red blood cells. So usually anemia, lack of red blood cell production. If you look at the white blood cells, in white blood cells, two diseases can happen here. Too many white blood cells will show you have a disease. Too few can also show you have a disease. If you have mononucleosis, you will have an increased production of white blood cells. If you have HIV or AIDS, you will have a decreased production of white blood cells. So it's not necessarily the amount, but the relative change that's important. In coagulation studies, basically you look at your clotting, your bleeding time, how quickly it takes for you to clot. And that is pretty much the blood unit. Please pay attention to the words. Leuco means white, thrombo means clot, lympho are white blood cells having to do with the lymphatic system, which we'll discuss later. Gen is a producing or a precursor, so fibrin. Gen is the inactive form of fibrin. Emia is word, and panemia means lack of. Sorry, emia is blood, and panemia is lack of. There we go. With the blood, please make sure you know your components and your functions of your elements.